right, good morning, everyone. Appreciate the opportunity to be here today and join you. So I wanted to give everyone a little bit of insight into kind of how AI is obviously transforming a lot of different industries, but especially healthcare, and how at CMS we're focusing on how do we leverage AI at its greatest, at its kind of greatest scale within the organization. So as everyone knows, AI is transforming every major industry. In transportation, we have AI powering autonomous vehicles. In finance, it's driving fraud detection and underwriting. In retail, it's enabling highly personalized experiences. And in logistics, it's optimizing supply chains dynamically. But in healthcare, we still have patients showing up to their practices at their doctor visits and filling out the same clipboard manually every time. The gap isn't about AI capability in healthcare. It's about access to usable, connected data. Healthcare doesn't have an AI problem. It has a data access, usability, and incentive problem. Data is fragmented across the system, locked behind patient portals, not accessible in real time, and not structured in a way that makes it usable. No interoperable data means no scalable AI, and that's why at CMS, we're focused on making patient health records accessible at scale. Because if you want AI to work across healthcare, not just in isolated applications, you have to fix how data is accessed and shared across the entire ecosystem. AI at its core, this is about building a connected ecosystem, one where patients, providers, payers, and applications can share data seamlessly, powered by open standards, and driven by voluntary participation. So the private sector can compete on the quality of their products, not on who controls the data. Today, patients are stuck managing dozens of patient portals. What we're moving towards is simple. Patients can access their complete health records through the apps of their choice. No portals, no passwords. And importantly, this is structured, FHIR-based data that can actually be used, including enabling patients to interact with their data through conversational AI, rather than trying to interpret the data on their own. This fundamentally improves provider coordination. Instead of providers chasing down records for your next visit, they receive real-time clinical data at the point of care, which means they can finally move away from fax and clipboard workflows. And this only works because of standards. FHIR APIs and US CDI create a common language so systems can actually talk to each other. Not just moving data, but enabling structured bidirectional exchange across the ecosystem. So last July, CMS launched this effort. We started with about 60 organizations that were willing to move quickly with us. Today, that's grown to over 700 companies that have pledged to move the health tech ecosystem forward. That includes providers, payers, EHRs, patient-facing applications, and private and public sector organizations, all committing to deliver real interoperability, not just talk about it. All these companies have pledged to invest in and deliver on a set of interoperability MVP requirements. And importantly, many have already delivered just 9 months later after launching. So what did the initial 60 companies pledge to do? This wasn't a symbolic pledge. It was a commitment to actually build. These initial companies committed to delivering production-ready capabilities, not pilots, building against specific defined use cases, enabling patient access through identity-based retrieval, supporting bidirectional data exchange using FHIR, allowing patients to direct and share their data anywhere, providing auditability, enabling AI-driven experiences on top of that data. This was not a commitment to just build, it was also to go live within the 9 months. We just had a celebration last week where we brought together hundreds of companies that have already delivered on the MVP requirements to acknowledge what has already been accomplished, but the work that is still yet to come. So why now? Time is of the essence, and there's no better time than now. Technology has obviously changed dramatically and is rapidly advancing every month, especially with AI. But the problem is that interoperability in healthcare has not kept pace. So instead of waiting, CMS used its ability to convene and bring together the private sector to move this forward. So what are we fixing? At a high level, we're fixing three things: the data layer, making data accessible across all the networks; the identity layer, eliminating portals and logins; and real-world use cases that drive adoption. When those come together, you get real-time structured, FHIR-based data flowing across the system, which not only enables AI, it improves coordination across providers by ensuring that the right data is available at the right time. So let's talk about specifically what we're trying to achieve AI-related within the health tech ecosystem. One of the most important outcomes of this entire initiative is what it enables for patients. Once patients have access to their complete structured health data, they can use conversational AI to make sense of it. Not just viewing the records, but interacting with them. Imagine if you have complex, existing conditions where you have hundreds of health records, potentially across dozens of providers. If you're able to access all of those at a single endpoint, what would you do with thousands of rows of records, right? It's hard to make sense of that at scale. So with conversational AI, you can start interacting with your data, helping it make sense of the data for you, asking questions in plain language, getting explanations that you can understand, seeing how different parts of your health history are connected, helping you understand your medications, your conditions, your prior history, in context, not in isolation, surfacing insights, identifying gaps in care, highlighting potential risks, and guiding next steps, whether that's follow-up care, adherence, or lifestyle changes. And importantly, this happens in real time, based on your full longitudinal record and history. So we're not just giving patients access to their data, we're giving them the ability to actually use it, make sense of it, and take more informed action on their care. So on the incentive side, historically, interoperability didn't have a business model. Data sharing was often treated as a cost center. So alongside access, we're aligning incentives. Through CMMI, the Center for Medicare and Medicaid Innovation, they recently introduced an access model. And we're aligning incentives around outcomes and access in the access model, which requires data to be accessible and shareable. And also through the Rural Health Transformation Fund, we're supporting infrastructure and participation. Care goes where the incentives go, so we're aligning the incentives accordingly. So how does this unlock AI? One, completes the data. Two, it provides a trusted identity so that we know that the patient is who they say they are. And three, we provide real-time access. This ecosystem delivers on all three, not just for the systems. It gives patients the ability to use AI to understand their own data and to make more informed action. So, stepping back, healthcare doesn't have an AI problem. It has a data problem and a business model problem. We're fixing both at CMS, unlocking access, aligning incentives, and enabling scale through a connected, standard-based ecosystem, using FHIR to enable structured, bidirectional exchange of patient data. And when you do that, AI follows. That's how AI becomes real in healthcare, not in isolated pilots, but in the hands of patients and across the system at scale. Thank you all.